My name is Richard, and I'm currently studying environmental toxicology. My project relates to transformation particularly because within IBD, we see a systemic inflammation of the gut. And so there's been a lot of literature recently showing that systemic inflammation with the gut might be linked to increased levels of heart failure. My favorite part has definitely been the ability to be able to expand my skill set. And so building on a lot of my knowledge that I've had previously about bioresponsive materials, I've had a lot of time to try different things, which has been great.
My name is Jessica Tang, and my area of research is machine learning in virtual cardiac rehabilitation. So the goal of my research is to use AI to provide live feedback for patients doing cardiac rehabilitation exercises at home. My favorite part of my summer research experience so far has been contributing to the lab, not just through my efforts, but also my ideas, and also joining in on team meetings and seeing how everyone works together in a real hospital research setting.
My name is Jacqueline. My summer research this year involves engineering transient collagen composites for stress sensing applications in cardiovascular tissues. Gunther Lab is very collaborative, so although our main goal is kind of engineering collagen sheets, there's people working on creating the microfluidic device to fabricate those collagen sheets from scratch, and also other people who are looking at the application side, like myself. As someone who's just finished first year, hearing those perspectives and expertise really inspire me.
My name is Maria Betty, and the area that I'm researching is in biophotonics. The project that I'm working on is designing a remote optical monitoring system that monitors blood flow and your tissue oxygenation levels. And this is really useful for kind of monitoring cardiovascular health as well as after surgery, making sure there's no complications. I think what I personally hope to take away from this experience is I wanted more exposure to what research is. And I think it was also an amazing opportunity to kind of explore the impact that optics can have, especially bio-related applications.
My name is Jason, and I'm kind of doing more research on pulmonary hypertension patients. And with these patients, their pulmonary artery, which is important in the cardiac cycle itself, is experiencing much higher pressure, which as a result makes the heart work much harder and causes some failures and even a permanent remodeling of the pulmonary artery itself. And as a result, in some patients, this could cause heart transplants to be almost impossible. And for pulmonary hypertension patients, they need these transplants really in order to survive. I think for myself, I've been able to, and I also really hope to gain a better appreciation for this kind of research, because I think something my professors really emphasize is the fact that it is not only technically viable, but it's also clinically viable. And I think that they go to such a lengths to make sure that every method is able to be done on every patient, but it's also technically applicable as well. I think has really grown my appreciation for this kind of research and also research in the future.
Hi, my name is Nicholas, and I'm a fourth year engineering science student here at U of T. My area of research is on wearable devices and more specifically on pulse oximetry. Pulse oximetry enables the measurement of blood oxygen saturation, or SpO2, non-invasively. And even though this is commonly utilized in clinical settings, reports have shown that it tends to overestimate SpO2 by up to 2 to 3% for individuals with darker skin tone. And the impact of this is quite serious because of the importance of this SpO2 measurement in the care of patients with cardiopulmonary complications, and also leads to disparities in our current healthcare. And so my project is then to try to correct for this skin tone bias. It's a lot of problem solving skill because I think every week there's a new problem that comes up, and it's about how to approach them. The most important takeaway is, I think, the ability to ask the right questions.
My name is Sanya, and my area of research focuses on smart textiles for remote patient monitoring. So by testing different configurations, we're hoping to compare smart textiles to typical gel electrodes, which are used for patient monitoring, and we're hoping to monitor body fluids and other patient vital signs. Our long-term goal is to adapt textile-based solutions for patients living with heart failure. My favorite part of the summer research experience has just been the supportive environment. I have met so many amazing people in the Sleep DB lab, and I actually ended up applying for a master's program in the biomedical engineering program at U of T. I'm grateful for Transform HF for providing me with the scholarship and giving me the chance to work with such an amazing community.